Something very interesting about our brain is it's the one of the most complex part of our body, and not a lot is understood about it. But a few pathways have been shown to be very effective. So what happens? I'll give you a quick example. If you have stroke, some part of your brain gets damaged, so the cells die in that area, right? But the body part that is associated with that part of your brain will stop functioning. But one good thing about your brain is that this other part of the brain can take over the activity of that particular body part. So let's say your hand is disabled because some of the brain cells are dead, which would control your hand. Now some other part of the brain can take over this activity and control your hand. But this task is very difficult and challenging to do, right? Now, there are some specific ways by which this could be done. One of them is by trying to imagine doing the activity. So it's called vision or imagery, in which you try to observe, try to imagine, say, gripping something. Now, if you do this multiple of times through neuroplasticity, the brain will be able to link the movement of your hand and therefore take it over. Now, there are more of modalities. So this is the visual cue that we give. You can give audio cue, which again enhances neuroplasticity. Then there's passive movement that you make the patient do. So if you externally say make the patient's hand movable, so even that lets the brain to realize that, okay, I have this hand which can move, and how do I move it? The connections are made. So by tackling those different pathways, by exploiting those pathways, we are able to fasten up the entire process.
What is your plan? Are you going to sell it to business, or is it B2B or B2C kind of thing?
So we have both the models. First, we are going B2B, where we'll be mostly selling to the hospitals and physiotherapy centers. Initially, most of these patients would require some guidance from the physiotherapy center. But then some of the patients would require doing these exercises for a longer period of time. Mm-hmm. So in that case, day visiting the hospital or rehab center is not the best thing to do. So what would happen after that is the patient will be able to use the product right from their home. And therefore, we are making the product as simple to use as possible. And our product is very easy to use. You just have a button to click, and then the exercises are on the tablet. The exercises are in form of virtual exercises. And that gives you freedom to do n number of exercises, which otherwise you would not be able to do in a conventional rehab center. And with that, you'll also be able to share your reports remotely with the doctor, so they can give you remote consultation. So those kind of features we're building. So initially B2B and then B2C.
You've mentioned that this is a B2B and a B2C, but this product especially is into healthcare. And how easy is it to convince people in healthcare, either the doctors or patients or anybody involved here, to how easy is it to convince them with new technology like you are talking about?
It's very difficult. It's extremely difficult, but I would say it is better than what it was earlier. Now, a lot of doctors that we talk to have become more knowledgeable, have become more open to accepting new technologies. Okay. That is one thing. But yet you will find a lot of people being more aligned and more inclined towards the conventional technologies that have been going on. But then, nevertheless, there are a lot of people who are interested, and we initially focus those who are ready to adopt the technology, because if they can successfully reap the benefit out of it, it would be much easier to convince the rest. So that we have been doing. We have seen specifically the patients, as I said, they become very desperate to get back their movement. And as a result, we have seen that almost every patient that we have dealt with, they have been very keen on using the technology. One, that it makes rehab easy for them. Second is that it lets them see their progress. So because they are able to see how much improvement they are making day by day, that motivates them to use the product more, and it also instills their trust in the system. And that has been one key benefit, because of which we see that our technology adoption by the customers, patients, and the hospital doctors is being less of a problem for us as of now. But yeah, if we talk about reaching a larger mass, uh, then we'll have to devise strategic mechanisms to make the product more widely adoptable. And in case of rehabilitation, the important thing to note is that you have a recovery period, a window. Normally, it's 3 months to 12 months after you had the disability. During this period, you have the highest chances of recovery. But after that, the recovery chances reduces significantly. So if you are able to tap the benefit of these kind of interventions within this period, it's the best for you.